Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. Yesterday, we all came together in the legislature to observe a moment of silence to recognize the National Day of Observance, commemorating the people who died from COVID-19. Our lives changed a year ago as this disease swept the world. 65 Nova Scotia families mourn the death of loved ones, and that is something no one should ever forget. If you're uncertain about whether to get vaccinated, please remember what some people have lost and what this virus is capable of. I want to thank Nova Scotians for their perseverance during this time. The crisis isn't over, but there is light at the end of the tunnel. We will continue to support Nova Scotians impacted by this pandemic, and we ask you to continue to follow public health directives. We know that this has also been a long, hard year for business operators, notably those in the tourism sector. We understand the toll that COVID-19 has taken on your business. Just over a week ago, we announced $6.6 million to support small businesses in the service sector with a rebate on their property tax, and that includes a lot of restaurants. Today, my government announced a $7.3 million rebate program for hotels, motels, and inn operators. It's a one-time payment, again, cash in your pocket, for operators to use as they see fit. The program provides qualified operators a 50% rebate on their property tax paid for the first 6 months of the 21-22 commercial tax. We know it has been a challenging year for tourist accommodation operators, and we are here to help you. Now let's get to the latest numbers. Today we're reporting one case in the Eastern Zone, and it's still under investigation. This week we had a record number of vaccinations. On Tuesday we had 2,303. By the end of this month we expect to get more than 100,000 doses. This is more than we've received in the province to date. Once this is distributed, Nova Scotians will have access to vaccine available closer to home. A quick update on clinics. All 25 AstraZeneca clinics have their vaccine and are preparing to launch starting March 20th. 48 long-term care homes have now had their first dose of vaccine, and 20 of those have received their second doses. First doses have been delivered at 11 of the 13 First Nation clinics, and the final 2 are planned for next week. We are ramping up community pharmacy clinics now as vaccine supply increases. Booking for the 80-plus community clinics is going well. The appointments are filling up, but there's still availability at most clinics if you're born between the ages of January and April. If you haven't been booked, please go online and call. And if you're born between May and August, you can start booking as of this Monday. And the stories we're hearing from frontline workers about these clinics are heartwarming. Seniors are arriving early and excited to get their vaccine. Some have brought flowers for the immunizers. They are visiting and telling stories in recovering areas, at a safe distance, of course. And to our frontline immunizers, I want to say thank you. We now have hundreds of people who have been or are being trained to give COVID-19 vaccines to support the clinics. Many of you have come out of retirement. Many of you are doing it in addition to your regular job. Many have taken short-term employment, and many have volunteered. Thank you all for providing such an important service to Nova Scotians. This has been a long, hard year for Nova Scotians, and I think that we will need to hear about the kindness and hope that our frontline immunizers are seeing. Next week is March break, and while it will be different than last year when we were in a full lockdown, it will still be different than what we are accustomed to. So I urge all kids to have a great week, but continue to observe all the public health directives. Lastly, I want to note that last night I joined my fellow premiers on a call with the Prime Minister. I raised the issue of temporary foreign workers and the importance of a smooth and safe process to get these workers to our region. I know these workers are essential to our seafood and agriculture sectors, and I look forward to learning more in the days ahead about the federal government's plan in this regard. Thank you, and I'll now turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. As the Premier noted, our case numbers are staying very low. We are not seeing cases or investigations that are giving us cause for undue concern. This is very good news for a number of reasons, one of those being our vaccine rollout. Low COVID activity means that we can place our main focus on the rollout of vaccines. On that note, a few highlights where we are at our vaccine program. We are nearing the end of the limited supply phase, where we primarily focused on healthcare workers directly involved in COVID care and long-term care residents and staff, as well as developing, testing, and refining the different models of vaccine delivery. We are well positioned and ready to start to deliver the increasing amounts of vaccine that we are expecting to receive in the next few weeks. The Premier mentioned that we will receive more vaccine than over these next few weeks than we have received to date. And that the work we've done on our program, that means we will be able to get vaccine into many more community locations in the next few weeks ahead. By the end of March, Nova Scotia will have tested all models of vaccine delivery to work out the kinks and make sure we're ready to expand our rollout quickly and effectively. We've had one of the first community clinic facilities for those 80 plus and older in the entire country. We have one of the first community pharmacy clinics for those 80 plus and older in the entire country. We have developed an online central booking portal where all vaccine appointments will be booked. When it's your turn to get vaccinated, Nova Scotians can go to this portal to see what's available in their community, make choices about the timeline and distance that they want to have for when they for getting a vaccine, and then they can book their appointment. And if people can't or don't want to book online, there's a toll-free number that people can call as well. So between the community clinics already running and what will be a growing network of pharmacy and doctors' offices clinics, you will have many choices in or close to your community over the next few months. Let me shift gears to talk about our the last year and what March 15th means. It means that we're on the 1-year mark of this pandemic arriving here in Nova Scotia. March 15th, 2020, we announced 3 presumptive cases of COVID-19, and that we would confirm as positives the following day. And I don't think any of us could have imagined then just how much our lives would have to change. The impacts have been far-reaching and felt by all, but none more so than the 65 families who lost loved ones to COVID-19. While we have been fortunate to be among the safest places in the world throughout the pandemic, these deaths do weigh heavily on all of us. They serve as a stark reminder of what this virus can do and how it is important for us to not let our guard down now. I'm also reminded of what Nova Scotians have done. You have shown the world what can be accomplished when everyone comes together to support and care for one another and places our collective well-being ahead of individual concerns. I hope we can all recognize how far we've come in the past year. We've all worked hard to be in a position where, unlike many other places, even in this country, where we can, by and large, go to work. We can go to the gym or go out for a meal at a restaurant. Our children can play sports and go to school. And while some activities and sectors still aren't back to normal, there is a light at the end of this tunnel. On that note, March break is next week. Last year, we were fully shut down. This year, with good protocols and plans in place, day camps will be running. So for children and youth, I hope you all have a fun week off school. No matter what you're doing next week, remember to do everything you have been doing this past year to keep yourself and others safe. For parents, encourage your kids to keep their social circles small and practice good public health protocols. For all families and for individuals, take an opportunity to explore your community or another part of our wonderful province, but do so safely. Please only travel outside of Nova Scotia if it is absolutely necessary. And if you do travel outside of the province, you will need to complete a full 14-day self-isolation period when you return. Our commitment to the 14-day quarantine, public health protocols, and robust testing programs have been keys to our success. To end today, I'll leave you with a few requests. I know many of you are anxious about your vaccine, and it's wonderful that there is such a desire to get vaccinated, but I do need to ask people to continue to be patient. We're just now starting to get larger amounts of vaccine, and we have about 800,000 people to vaccinate. Over the next several months, every adult Nova Scotian will get an opportunity to get vaccinated, with sequencing based primarily on descending age. I do need to ask that you please stop calling or going to your doctor's office or local pharmacy. You cannot book your vaccine appointment through them directly, and you cannot just walk in. And we're having many requests from pharmacies and doctors' offices who are getting overwhelmed. We have online information at a coronavirus website around the vaccine, and we have the 1-800 line and the online appointment tool for booking an appointment if you're eligible for vaccine at this time. So please use those. Again, you cannot, doctors' offices, pharmacies cannot make an appointment for you. You cannot just walk in, so we need to use them appropriately. As I said, you can only book your appointment through the online central booking system or the toll-free number. Finally, if you're 80 or older and born now between May 1st and August 31st, starting this coming Monday, you too can book your vaccine appointment. If you're 80 plus and were born between January 1st and April 30th and you haven't yet booked, you can still do so. So seniors who are now starting Monday between January 1st up all the way through to August 31st, go online or call the toll-free number if you're 80 years of age or above. If you're 63 and would like, 63 or 64 and would like to get the AstraZeneca vaccine at one of the 25 locations that will start running March 20th, booking will open for these clinics coming next Tuesday. So I wish everybody a safe weekend and March break, and remember, we are in a time when we need to continue to be COVID safe while we see spring coming and we see hope with a vaccine.
We'll now take one question and one follow-up for reporters in the room and on the phone, starting with Alicia Drouse with Global.
Thank you. You guys are expanding the 80 age group right now. I'm just wondering, rather than kind of expanding it from April to August, why not either expand it for the whole year, anyone who turns 80, or just move down the age group, open it up to the next 75 to 79 age group?
So this is not about having vaccine in supply. This is about getting the appropriate numbers at any given time, looking to get an appointment through the online booking process. So we said we'd do this break up the year into 3 chunks of 4 months. So we opened it up first for January to April. They've had an opportunity. We've gotten significant demand through that piece, but now we're ready to be able to open up to the next group. And we'll announce, depending how that goes, then we'll be able to open up to the September through to December.
Go ahead with your follow-up, Alicia.
And there are concerns right now in Europe over blood clotting when it comes to the AstraZeneca vaccine. Obviously, we're starting that rollout next week, so I'm just wondering if there are any concerns with the AstraZeneca that we have here in Canada.
We've talked about this nationally. First, I mean, people have to understand that we don't actually have that specific product here in North America. We're using a product from a different manufacturing site, so it's not specifically the same product. When we talk about vaccines and safety pieces, we talk specifically about identified lots, and we don't have that here in North America. The second piece is has been reviewed. We're certainly the Public Health Agency of Canada is part of international discussions looking at this closely. They're sharing information with the provinces and territories. The steps that were taken in Europe were very precautionary, and I think people should see it as a sign that across the world we take vaccine safety very seriously. So just because something happens in the time frame around where you've gotten vaccinated doesn't mean at all that it's caused by the vaccine. But when you see several reports of something similar, we will take necessary steps and then to do further assessment. So anytime we see what we call a safety signal like this, it's taken very seriously, and then appropriate steps are taken in those jurisdictions, and the rest of the world watches and waits. But there's no indication at all that at this point in time that these events are actually caused by the vaccine, and the steps that have been taken by countries, even themselves, those countries are saying they're out of an abundance of caution.
Next question will go to All Nova Scotia's Lindsay Armstrong.
Thank you. I'd first like to ask the Premier if there's been any progress on the discussions around the maritime bubble. if there's anything more you can tell us about that. And I'm wondering when, in your mind, would be the ideal time for this to be open?
So next Wednesday is the scheduled discussion with with my colleagues in Prince Edward Island and New Brunswick. We'll obviously have a loop in with our public health teams, and we won't be moving forward until we have full comfort from all three teams. And in terms of what I'd like to see, I did reach out proactively to see if we could start engaging in discussions. So sooner the better for me, but obviously we're going to take that cautious approach that we've done throughout the whole pandemic, and that served us very well in Nova Scotia.
Go ahead with your follow-up, Lindsay.
Thank you, and this is a question for Dr. Strang. I know I've asked you this before, but I'm curious if there's been any progress on being able to identify the variant cases of COVID locally with sequence testing, and I'm wondering about how much funding would be needed to make that happen.
Yeah, there's a funding ask in that, and I don't have that number specifically. We have it in an application to the federal government. We're waiting to hear a report back on that. It is a substantial amount of money to build that capacity here, and like I said, we're waiting for that answer from the federal government.
Next question will go to Jack Julian with CBC.
Thank you. My questions are for Dr. Strang, and it's all about contact tracing, because now that things are calming down, we can start, talk about patterns a little more. There have been several announcements of possible exposures on airplanes, by row and seat number. I'm wondering how many transmissions have been linked to air travel or to those possible exposures.
So I'm not aware of a precise number, but we talk a lot about this at the national level, and I think the general conclusion from around the world is that transmission on an airplane has been very rare.
But none that you're aware of specifically on flights to Nova Scotia?
We have not had any cases where our conclusion would be that they were exposed on the airplane.
Go ahead with your follow-up, Jack. Go ahead with your follow-up.
Thank you very much. My other question is about, there's regular warnings about potential exposures at restaurants or at stores and that sort of thing. I'm just wondering, through contact tracing, how many confirmed transmissions there have been from those exposure sites and those specific warnings.
So I'd have to go back and look the exact number, but we've had a very small number. Understanding that most of those notifications, that there's a low to moderate risk on those. And being able to, I think off the top of my head, there's only one or two cases that I can say that we've concluded that their only source of exposure was at that notification site. Many of our cases, they've been at maybe more than one notification site, but they've also been other sources of exposure. So for many of our cases, we can't pin down a specific single cause of their exposure. Those are the cases when we have to say, well, they're not from travel, they're not a known contact of a previous case. What is their source? We're usually left with an answer of there's probably a number of potential sources for them, because the virus gets transmitted in a whole range of different settings.
Next question will go to Tim Biscay with the Halifax Examiner.
Dr. Strang, I want to follow up on that. In your remarks, you said that there's no concern, that you're not overly concerned about any of the cases that are out there. But the one announced today, it's only one, but there was one announced today that's under investigation. That apparently doesn't cause you concern. Will we ever get, some indication of what happens with these under investigation, or are they just forever written off as?
No, some of them we conclude, and the one today, I know some of the circumstances behind it. I'm not going to jump to conclusions, but the circumstances that I've been made aware of don't give me any concern that's around local transmission. So, but some of the cases, we as I said, we do come to a conclusion, and then we can actually say, sometimes it turns out that actually they were related to travel. It just takes us some time to identify or more it turns out that they were actually, by the investigation, we can link them back to a known case or a travel through a couple of steps. Other cases, we just are left with a conclusion. We've had a number of those right now. We still don't have any conclusion on where they might have been infected. Still, that's why we still continue to promote testing. We're still continuing to be very cautious, because we have had a few of these signals yet unanswered that there may be some low level of transmission of the virus in communities in Nova Scotia. So again, all the more reason why we still need to maintain caution. Even though our epidemiology looks good, low and stable, we cannot relax.
Go ahead with your follow-up.
I wonder if you could speak to public health generally. We published an article last week showing that public health is underfunded in Nova Scotia, and you're obviously doing much concentrating on COVID, but there are other responsibilities for public health, and the standard seems to be 5%, 5 to 6%, and Nova Scotia funds about 1% for public health. And do you need more money, or are we falling down on public health, other public health, non-COVID related concerns because of lack of funding?
So there's no doubt that we've had to turn all our public health resources in upon COVID, but that's not unique across the country. Virtually all of public health has been devoted to COVID. Again, across the country, there's a long-standing issue around how much investment has been made in public health. We are working with the current government to look at how we may continue to invest in public health, as we learn from COVID.
We'll go to the phones to CTV's Natasha Pace.
Thank you. Dr. Strang, I wanted to know if whether or not we're still in the phase one of the three-phase vaccine rollout. Are we still in the first phase of that rollout? And if so, when do you expect we'll be moving into the second phase?
Well, our first phase was really, we call it phase, but really it was we're now trying to change the terms a bit. We're in the stage when we actually have limited supply. And we're still in that stage. Even though the supply is going to start to increase, it's still going to be limited. We expect we'll be able to move, based on the projections of what we expect for vaccine, we'll be able to be in a state where we get much more, when we have large amounts of vaccine, or let's call the stage the robust supply. We expect to be at that state in somewhere mid to late April.
Go ahead with your follow-up, Natasha.
Thank you. Premier, I know you said you have a call next week with the other premiers to talk about the Atlantic bubble, but I didn't hear an actual date. Are you targeting, June or July to hopefully have the Atlantic bubble back up and running?
So I don't want to speculate too much on how that conversation will go, but we'd be probably looking at earlier than that. All premiers have talked about the need to try to open up commerce and activity throughout our provinces, but we've done very well epidemiology-wise in the Maritime provinces and Atlantic Canada. So we're going to be looking at all opportunities as long as we have the advice from public health that it's time. As you know, PEI, the travelers from PEI coming here don't have to self-isolate. New Brunswick, their cases are descending, so that gives us optimism that we'll be able to do it sometime in the spring.
Next question will go to the Herald's Nabal Snan.
Good afternoon. Dr. Strang, I was wondering, on the GIS dashboard, some cases are not assigned to a specific community health network. So what does that mean? Where are they located?
That's a level of detail. We'll get one of our comms people and our epidemiologists to look into that so we can give you a precise answer after this.
Go ahead with your follow-up, Nabal.
Okay, thank you. And I was wondering if you can update us on your conversations with the African Nova Scotian community regarding the vaccine community clinics that we're planning to have there.
Yeah, and we're still in discussion with them. I think in the next week or two we'll have much more concrete information that we can provide around exactly where and when clinics would start.
Next question will go to Victoria Walton with The Coast.
Thank you. Dr. Strang, I'm wondering about if someone misses their vaccine date, a scheduled appointment, because they were either self-isolating because of a potential exposure or contact, or if they're ill, just, common cold and don't want to leave the house and therefore have to miss their vaccine. What's the process there for rescheduling or something?
So if they have a scheduled appointment and for some reason they could go back online and then rebook that. Certainly, people. The other question, and people say, well, what if they're eligible and for some reason they, I'll take the example. We've had seniors 80 plus January to April, and now we're going to add on May to end of August. the people who are in January to April who you haven't yet booked an appointment, they're still eligible. So as we roll this out, once you become eligible, you're always eligible, even if for some reason you've missed your opportunity initially when your group became eligible.
Go ahead with your follow-up, Victoria.
Thank you. And Dr. Strang, this is for you as well. I'm wondering if you have any estimate of what percentage of appointments are being made online through the portal versus over the phone. Is it just a small percentage being made over the phone?
A very small percentage, or even with the seniors 80 plus, the vast number of appointments are being made online, and we encourage people to do that. It is the most efficient way for them, and we do have limited capacity on our phone lines.
Next question will go to Brooklyn Curry with CBC.
Thank you. Dr. Strang, you said that we're nearing the end of the limited supply phase and approaching, as you said, in mid-April or so, the robust supply phase. I'm wondering, do you have any sense of whether vaccinations will proceed at a rate that could allow for an almost, somewhat normal tourism season?
So it's not just the number of vaccines people vaccinated, that's one factor, but as we've talked about here before, we're still waiting evidence to be able to answer the question, if you're vaccinated, can you still spread or transmit the virus even though you yourself may have no symptoms? There's some evidence on that to say that if you're vaccinated, it doesn't, but we still don't have conclusive answers on that. So we're left right now that we have to say that people, even though they're immunized, still may be able to transmit the virus, which means has all sorts of implications for them having to, even if you're vaccinated, you have to quarantine, wear masks, and all those kind of pieces. We'll, over the next number of, the next few months, I think we'll get greater clarity and then be able to start to say, well, if you're vaccinated, these are the things that perhaps you don't need to be as restrictive about. But it's premature to say exactly how that would impact the summer.
Go ahead with your follow-up, Brooklyn.
Thank you. In Cape Breton, people in the northern part of Cape Breton, north of Smoky, who are 80 plus, looking to get their vaccines, right now they need to drive 3 hours each way, just about, to get their vaccine at Cape Breton University. Yesterday and again today, the health minister said that people should be driving, no more than 45 minutes or so to get vaccinated. So I'm wondering, is anything being done to get people in those really rural northern parts of Cape Breton vaccinated? Is there a consideration to give funding to either municipalities or their transit services to help get people to vaccine clinics?
So we have two things. We're aware there's a few parts of the province that are outside of our target of people having no more than 1 hour drive to a clinic. And we're aware of those, and that's why we're very deliberately, as we start to roll out more pharmacy and physician clinics, we're very deliberately making sure that we're covering those areas as much as we can with those types of clinics. For people across the province who may have challenges with transportation getting to a clinic, we are partnering through the Department of Communities, Cultures and Heritage with the Community Transportation Network, so people can actually get assistance at a very small fee and getting assistance and getting a drive to a vaccine clinic.
We have time to go back to the room for one more question and one more follow-up per reporter. We'll start with Global's Alicia Draus.
I'm good, yeah.
Moving on to All Nova Scotia's Lindsay Armstrong.
I'm wondering a little bit about what experience people can expect at the AstraZeneca clinics compared to the Pfizer and Moderna clinics. Is there going to be much of a difference in that whole sort of rollout and what that looks like?
No different. I mean, it'd be exactly the same, regardless of what vaccine product you're getting, whether you're like any pharmacy clinic or a physician's clinic. Same kind of experience people get, whether it's their annual flu shot or your kids going in for a routine immunization. All those pieces are the same. It's the vaccine product itself that may be somewhat different.
Do you have a follow-up, Lindsay?
Yeah, I'm just actually going to go back to an earlier question and wondering about that sequence testing timeline. Is it still about a month between getting the test identified and getting that result back? And are you comfortable with the amount of time it takes to identify a variant?
That's the turnaround time for non-urgent cases. But if there's urgent cases, we can request those to the lab, and the turnaround time is usually a week or a little bit less than that.
Moving on to CBC's Jack Julian.
I'm just going back to the sequencing. I remember last week, I believe, there was a case that wasn't connected to travel, and there hadn't been any ability to contact trace that variant case. Is that still true? An open question?
We're still working through. There's now some potential links between that case and a previous, it's the South African variant. We haven't confirmed those, but we're still, that's right. Part of it takes some time to do. It's very much like detective work, interviewing people, drawing links, and we've got a potential connection that we have to explore further to see whether that actually plays out or not.
Jack, do you have a follow-up? No follow-up. Moving on to Tim Biscay with the Halifax Examiner.
Dr. Strang, you said that the vaccination people are working through the kinks in the program, to be expected. What kinks have you experienced in? I've asked you before, and the vaccine waste percentage was very, very low. Is it still?
Still very low. That's one of our key parameters, and that's why we're having we're not letting all pharmacists and all physicians just get the vaccine, because then you have very high wastage. We can't afford to waste this vaccine. It needs to be in a much more structured type of program. What we're learning from the clinics is are sometimes simple things that actually improve efficiency, flow of people, things like that. We learned something, through the IWK clinic, the first 80+ clinic there. We had process engineers who were just standing observing, and they had a number of seemingly small but very useful kind of observations that allowed us to increase the efficiency, but also make it a better experience for people as they're coming through the clinic. We're learning the same kind of things from our pharmacy clinic. So things that may seem on the surface small, but they actually create greater efficiency, but also a much better experience for people as they're getting vaccinated.
Tim, do you have a follow-up?
Do you have an example?
So one of the things we recognize that when we started doing the 80+ clinic at the IWK, that almost everybody was coming with a support person. And we hadn't anticipated that. So certainly for the seniors clinics, we have to adjust that in terms of seating and the space you need, because you're dealing with two people, one person to get their vaccinated and the other person with a support person. So simple things like that until you actually do it, you may miss some things, but then there are often simple things that you go, okay, now we can improve that. So the principle is that these are big. This is a big complex thing we're rolling out. So we have to try all these things first. There's a motto that our armed forces people keep telling us that they use, is that you get good first, and then you can go big and go fast.
We have time to go back to the phones for one question and one follow-up, starting with CTV Natasha Pace.
Thank you. Dr. Strang, I'm wondering if there's been any more thought to offering people with complex medical conditions, kind of prioritizing them in the vaccine rollout. I think last time you were asked about it, they weren't specifically identified in phase 2, which is where they are in New Brunswick and PEI.
So we recognize those concerns, but we're still very much that our goal is to immunize as many people as possible in the shortest time possible, because what that does is produces a rapidly increasing level of population protection, which then protects everybody, whether they're immunized or not. And the way to do that is to have an age-based approach in descending age cohorts. Easy to identify people, easy to have them go online, register with proof with their age, all those pieces. It makes for a very efficient, and our planners have looked at this extensively. If we start to divert and do different medical conditions or different types of occupations, what that does is substantively slow down our ability to build population immunity. So as I've said this publicly before, and I'll say it again, my job is to say what is the best for the health of all Nova Scotians. And that what's best for all Nova Scotians is to build as fast as possible the highest level of population immunity, because that protects everybody, whether they're vaccinated or not.
Natasha, do you have a follow-up?
I do. I'm just wondering, are we still technically in the second wave of this pandemic, and do you anticipate there being a third wave in Nova Scotia?
Yes, we are. I mean, if you look at data around the world and in Canada, we're clearly at on the coming out of the second wave, but we're still in the second wave. Whether we have a third wave, I think that's a lot of the uncertainty around the variants and what impacts introducing a variant and having it spread widely might do, and that's what makes all of us in public health nervous. So a bit of an unanswered question, but that's also why we need to focus on, to my previous answer, why we need to focus on building high levels of immunity in the population as quickly as possible, because that's what we need to prevent, even if we get an introduction of the variant, the higher levels of immunity we have, the less chance of it actually having widespread.
Next question will go to Nabal Snan with the Herald. Nabal, are you still with us?
Thank you. Yeah, I'm still here. Sorry. So, Dr. Strang, we've talked a lot about the importance of cultural competence in giving the vaccine to Indigenous communities or to African Nova Scotian communities. I was wondering if there were any conversations regarding that with the migrant and refugee communities.
Absolutely. We're working very closely with ISANS here in Halifax, and they're advising us not just in the Halifax area, but other recent populations of recent arrivals to Canada. So very much aware of that and needing to work with the NGOs and others that support those communities as part of how we ensure that those communities have as much access in a culturally acceptable way as any other Nova Scotian community.
Nabal, do you have a follow-up?
No, thank you.
Next question will go to Victoria Walton with the Coast.
Thanks. Dr. Strang, something we've talked about a little in the past is people getting vaccinated along with their spouses, especially in that older age community. I'm wondering if that's still something we're considering now with the tight age-based requirements, or if that's ever going to be a possibility, you know, people with spouses in a similar age range getting vaccinated in one appointment.
Yeah, I know the folks who are kind of doing the online booking stuff are going to take that away and see what we recognize that and see what was possible around that. Booking couples together. I haven't heard back from that, but we'll look into that, and we can perhaps give you an update on that next week.
Go ahead with your follow-up, Victoria.
Thanks. And Dr. Strang, talking about doctors' offices, pharmacies doing some vaccine rollout. How are we avoiding interfering with typical health care that still needs to be provided at those clinics and pharmacies?
So that's why we've approached both the Pharmacy Association of Nova Scotia, Doctors Nova Scotia, and I'll use AstraZeneca just as an example. We said we need 25 sites, and they've identified between them 25 sites to deliver the AstraZeneca. We have the same process. We need a number of sites spread across the province, recognizing rural isolation, those kind of pieces, and ask them to then reach out to their members as to what type of clinics they could provide, and we've given them clear criteria on those clinics. So we're doing this in a way that focuses our immunization through specifically identified pharmacies and physician offices, knowing that there's many other healthcare needs that have to be met both within those offices, but more importantly outside in all the other pharmacies and all the other physician offices. The reason we're trying, especially in primary care, there's many needs for primary care. So we're working to make sure they have a very focused approach around the vaccine and minimizing any impact on any other primary care delivery.
Next question will go to Brooklyn Curry with CBC. Brooklyn, are you still here? It's our press conference question period for today. Go ahead, Premier.
Thank you. We've had a good week in terms of low cases. We're making progress on vaccinations as we ramp up to a more robust supply. And the building of the delivery infrastructure is also showing good progress so that when we get more vaccine, we'll be ready for a really efficient distribution. To all kids out there and their parents, have a safe and enjoyable March break, while respecting all of the health protocols, wearing your masks, keeping a distance, and washing your hands. Thank you.